Just before that bill was going to be passed, Elon Musk, the wealthiest man in the world, who does not have to worry about whether he and his friends can afford health care, he sent out a series of tweets, some of them outrageously dishonest, to kill this legislation, and he succeeded in doing so.
Señores, parece que el nuevo pasatiempo favorito del Partido Republicano es asegurarse de que la gente en Estados Unidos pierda acceso a su salud, pierda acceso al seguro social, pierda el acceso a los beneficios sociales. Bueno, como no podía ser de otra manera, uno de los personajes con el historial más turbio en fraudes relacionados con el tema de la salud, el senador republicano Rick Scott, tenía que meter la cuchara en este tema, ¿no? No podía quedarse fuera. Pero en esta ocasión se opuso a un proyecto de ley impulsado por Bernie Sanders, uno que tenía objetivo bastante simple, la verdad, que es evitar que las personas terminen en bancarrota por los costos médicos, garantizar que los niños puedan ir al doctor sin que sus padres se endeuden de por vida. Pero bueno, ¿qué hizo Rick Scott? Exactamente lo que esperaríamos de él. Por eso mismo, Bernie Sanders lo enfrentó, lo puso en su lugar y lo dejó sin palabras en una audiencia al vivo en el Congreso. Sean bienvenidos a Políticamente Desacuerdo. Amigos, hoy veremos cómo una vez más el senador Bernie Sanders ha callado, ha destrozado a los republicanos en el Congreso de los Estados Unidos. Así que los invito a que se queden hasta el final de este video porque veremos los detalles más interesantes. Bueno amigos, para no hacer muy largo este tema, quiero que vayamos directo a ver el momento más interesante entre Bernie Sanders contra Rick Scott. Veamos este clip.
Generally speaking, when I talk to a group of people, I ask them a simple question. I say, what do you think about the healthcare system? Is it working well or is it broken? Is it dysfunctional? And overwhelmingly, the hands go up that the American healthcare system today is broken, it is dysfunctional, it is cruel. And what people understand is the function of the American healthcare system today is not to provide quality health care to all of our people, which in fact goes on in every other major country on earth. It is to make huge profits for the drug companies and the insurance companies. Mr. President, the current health care system is a system in which we spend twice as much per capita on health care as do the people of any other nation. Astronomical sum of money. And yet, despite all that money, 85 million Americans are uninsured or underinsured, and the cost of health care keeps going up every single year. 1 out of 4 Americans cannot afford the cost of the drugs that their doctors prescribe. And unbelievably, it is a system in which 60,000 Americans die each year because they can't get to a doctor on time. It is a system in which we don't have enough doctors, we don't have enough nurses, we don't have enough dentists, we don't have enough pharmacists. But the good news is the insurance companies and the drug companies are making huge profits. The current healthcare system is a system in which our life expectancy is lower than any other major country, and if you're working class in America, you're going to live 7 years shorter life than if you are wealthy. It is a system in which some 500,000 people go bankrupt each year because of medically related debt. It is a system where in large parts of our country, rural hospitals are being shut down and where people, even with decent insurance, have to travel hours in order to find a doctor. Mr. President, as Senator Wyden indicated, in December, after months and months of difficult negotiations, and I want to congratulate Senator Wyden, Senator Crapo, and all the people involved in those negotiations, we made some progress on this healthcare crisis by coming together on a bipartisan and bicameral agreement on a healthcare package. That legislation, while more modest than I would have wanted, would have provided $4.5 billion for community health centers this year and $4.6 billion next year, up 15% from a few years ago. Community health centers provide primary health care to 32 million Americans, working class, lower income people. Do a phenomenal job, but they're under financial stress. That legislation would have provided $350 million a year over 2 years for the National Health Service Corps, so we can attract young people to go out and work, young doctors to work in underserved areas. And it would have provided $300 million a year for teaching health centers. It would have also lowered the outrageous price of prescription drugs by taking on the greed of pharmacy benefit managers. It was a bipartisan bill. And just before that bill was going to be passed, Elon Musk, the wealthiest man in the world, who does not have to worry about whether he and his friends can afford health care, he sent out a series of tweets, some of them outrageously dishonest, to kill this legislation, and he succeeded in doing so. So today, Mr. President, it is important that we take a step forward and undo the damage that Mr. Musk caused. And the legislation that we are proposing today would in fact begin to take us back where we were. It would increase funding for community health centers and do all of the other important work that Senator Wyden wanted. We have a health care crisis in America today. The CR that we're going to be voting on in a little while will make a bad situation worse. This is an opportunity to tell the American people that we are aware of the health care crisis. We are at least trying to do something. We have a health care crisis, 85 million uninsured or underinsured people dying because they can't afford health care. We pay the highest prices in the world for prescription drugs. We have reached a bipartisan conclusion to go forward in a modest way, but it would have some impact in improving health care in America, and my Republican colleague objects. That's about it. Well, I hope the American people are watching.
Este es el tipo de política de los republicanos. Prometen en campaña que van a reducir el costo de vida. Pero ¿qué es lo que realmente hacen? Mientras los precios de los huevos se están disparando, la bolsa de valores está tambaleando y el fondo de retiros de muchos sufre por culpa de Donald Trump. Los republicanos están ocupados tratando de desmantelar los programas esenciales que realmente ayudan a la gente a vivir con dignidad. Cuando los demócratas intentan frenar sus ataques al sistema de salud, ¿qué hacen los republicanos? Se oponen. Es el único momento en el que prácticamente levantan la voz. Hace apenas un par de semanas vimos a la congresista Jasmine Crockett pidiéndoles que admitieran una verdad simple, que Rusia invadió Ucrania. ¿Cuál fue su respuesta? Un silencio total. Pero cuando se trata de evitar que los niños reciban atención médica, ahí sí que saltan como resortes. ¡Qué sorpresa! Pero bueno, no solo es Rick Scott. Esto ya es un patrón dentro del trumpismo. Lo vimos en su gobierno y lo seguimos viendo ahora con las personas que él quiere meter en el poder. Un ejemplo muy claro también es el Dr. Oz. Otro personaje que Donald Trump está desesperado por poner en un puesto de poder. A pesar de que su única cualificación parece haber sido ser un charlatán en televisión. En su audiencia de confirmación, los demócratas lo destrozaron. Pero hubo un momento en particular que me pareció brillante. Quizás es porque, es amiga del programa, ¿no? Pero Elizabeth Warren lo dejó sin argumentos. Veamos este clip.
So Dr. Oz, insurers pocketed an extra $178 million in taxpayer money last year thanks to just this one fake diagnosis. Does that sound like Medicare fraud to you?
Senator Warren, I appreciated you spending time with me in your office. The answer is yes. It's
Good.
anatomically impossible, and I'll give you one more example.
Okay.
Which is sending someone to your home, which you brought up in the office. If you're going to say it, I won't say it, but you pointed out something that's very real, which is if you send someone if an insurance company sends someone to your home, there's probably a reason for it. And so if they're doing ultrasounds to look for minor atherosclerotic plaques, which is not really something that needs to be treated, and most Americans have, it's primarily done to upcode you, which has two problems. One, it's cheating because you're able to charge more for those patients, but then people who truly have limb-threatening peripheral vascular disease, who have that box checked in their care, those companies, insurance companies, don't get paid more. Those doctors don't get reimbursed more for doing what is ethically correct. So it doesn't just help the scoundrels who are stealing from the vulnerable, it's actually hurting the people trying to take care of those vulnerable populations.
In fact, let's talk about how bad that upcoding is that comes from the home visits. HHS Inspector General found that in 2022 alone, United Health used these home visits to add about $2.3 billion worth of diagnoses that led to absolutely no treatment. And I take it you think that sounds like fraud as well.
We are, I think, as an agency, aware of this. I haven't been in there yet, but if confirmed, this will be one of the topics that is relatively enjoyable to go after because I think we have bipartisan support.
I love hearing this. So upcoding is a scandal. And overall, we know that Medicare Advantage overpayments cost at least $83 billion in a single year. So $83 billion, remember that number. Last month, Republicans in the House passed a budget framework that sets up $88 billion in annual cuts to health care, Medicaid funding for seniors in nursing homes, and for people with disabilities who have a home health aide and more. So Dr. Oz, I have a simple question. If you had the choice, would you rather cut waste, fraud, and abuse by a Fortune 50 health insurance company in Medicare Advantage or cut funding for Medicaid, which covers half of all seniors in nursing homes and 1 in 3 of America's children?
My goal is to improve the health care of the American people. And as you create the argument, the former sounds like a more rational way to do that.
I appreciate that. You know, I am happy to work with Republicans to go after waste, fraud, and abuse, but let's cut out waste, fraud, and abuse where it actually occurs, like upcoding in Medicare Advantage. Republicans cutting health care for seniors and for babies and for people with disabilities, while the waste and the fraud just roll right along for a multi-billion-dollar insurance company, is sickening, and I will fight that every step of the way. Thank you, Dr. Oz.
Ya lo he dicho varias veces, pero es importante repetirlo. Donald Trump no quiere a los mejores en su gobierno. Quiere a los peores. Le encanta los personajes de Fox News. Los que saben hablar frente a una cámara y repetir su propaganda, ¿no? Sin cuestionar nada. Quiere gente incompetente, porque así destruyen las instituciones, hacen que los verdaderos funcionarios renuncien y al final terminan cediéndole todo el poder a él. Eso es justo lo que los republicanos en el Congreso están permitiendo. Donald Trump acaparando el control total junto con Elon Musk, porque al final todo lo que hace Trump tiene el mismo objetivo, que es consolidar su poder y empujar a Estados Unidos a un sistema autoritario. Así que amigos, a resistir el trumpismo, no solo frenar sus acciones, sino que también oponerse a su verdadero plan, convertir esto en una dictadura. Muchísimas gracias por acompañarme hasta el final de este video. Como siempre, si me quieren apoyar, recuerda darle un like al video, comparte esto con tus amigos y suscríbete a nuestro canal Políticamente en Desacuerdo. Nos vemos en el próximo video. Hasta luego.